Pneumonia is a serious infection that inflames the air sacs in one or both lungs. These air sacs, also known as alveoli, are where oxygen and carbon dioxide exchange occurs during breathing. When you have pneumonia, the infection causes these sacs to fill with fluid or pus, making it hard to breathe and reducing the amount of oxygen that gets into your bloodstream. The severity of pneumonia can range from mild, which might feel like a lingering cold, to life-threatening, especially in vulnerable populations such as older adults, infants, and those with weakened immune system. The condition can be caused by various germs, including bacteria, viruses, and fungi. It's often spread through respiratory droplets when an infected person coughs or sneezes. It should be noted here that pneumonia can occur on its own or as a complication of another illness, such as the flu. Pneumonia is a common condition, affecting around 450 million people globally each year and accounting for over 2 million hospitalizations annually in the United States alone. Unfortunately, it remains a leading cause of death in young children and older adults, particularly in developing countries. Types and causes of pneumonia. Pneumonia can be categorized in two main ways, based on its cause and on where the infection was acquired. Let's start with its types based on its cause. Number 1. Bacterial pneumonia. This type is caused by bacteria, with Streptococcus pneumonia being the most common culprit. Other bacteria, such as Mycoplasma pneumonia and Haemophilus influenzae, can also lead to bacterial pneumonia. It often causes more severe symptoms, including high fever and productive cough, and can develop on its own or as a complication of another illness. Number 2. Viral pneumonia. Viruses like influenza, respiratory syncytial virus, and coronaviruses are common causes of viral pneumonia. Symptoms may be milder than bacterial pneumonia, but can escalate, particularly in individuals with compromised immune systems. Viral pneumonia often begins with flu-like symptoms before progressing. Number 3. Fungal pneumonia. This occurs when fungi such as histoplasma, coccidioids, or cryptococcus infect the lungs. It is more common in individuals with weakened immune systems or those living in certain regions where these fungi are prevalent. Number 4. Aspiration pneumonia. This happens when food, drink, vomit, or saliva is inhaled into the lungs instead of being swallowed properly. The introduction of bacteria from the mouth or throat into the lungs leads to infection. Now let's get to the types based on where it was acquired. Number 1. Community-acquired pneumonia, CAP. This is the most common type and refers to pneumonia contracted outside of healthcare settings. It can result from bacteria, viruses, or fungi and affects people of all ages. Number 2. Hospital-acquired pneumonia, HAP. This type develops during a hospital stay, particularly in patients receiving long-term care or those on mechanical ventilation. HAP is typically more severe due to its association with antibiotic-resistant bacteria. Number 3. Ventilator-associated pneumonia, VAP. This type is a subset of hospital-acquired pneumonia, and it occurs in patients who are on mechanical ventilation. The risk is higher because of the introduction of bacteria into the lungs through the ventilator. Number 4. Healthcare-associated pneumonia, HCAP. This type affects individuals who have had recent interactions with healthcare settings, such as nursing homes, dialysis centers, or outpatient clinics. Like HAP, it is often caused by antibiotic-resistant bacteria. Symptoms of pneumonia. The symptoms of pneumonia can vary widely depending on the type and severity of the infection, as well as the person's overall health. One of the most common symptoms is a persistent cough, which may produce mucus that is yellow, green, or even tinged with blood. This productive cough is often accompanied by chest pain or discomfort, which tends to worsen when coughing or taking a deep breath. Breathing may feel labored, and shortness of breath can make even simple activities, like walking across a room, feel exhausting. Fever and chills are also hallmark symptoms of pneumonia, with body temperatures often spiking rapidly. Some people experience intense sweating or alternating between feeling very hot and very cold. Fatigue is another common complaint, as the body's energy is directed toward fighting the infection. This profound tiredness can make it difficult to carry out daily tasks or even stay awake for extended periods. In severe cases, a person may experience confusion or disorientation, particularly older adults. Lips or nail beds may take on a bluish tint due to a lack of oxygen in the blood. For infants and young children, symptoms might include difficulty feeding, lethargy, or fast, shallow breathing. These symptoms can overlap with other illnesses, making pneumonia difficult to identify without medical evaluation. They also tend to develop gradually, though bacterial pneumonia may come on suddenly with rapid symptom escalation. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of pneumonia. When you go to the doctor with these symptoms, they'll usually start by listening to your lungs with a stethoscope. Healthy lungs sound clear, like air moving through an empty space. With pneumonia, doctors hear crackling or bubbling sounds, kind of like the noise when you pull your boot out of mud. They'll probably order a chest x-ray. This is the gold standard for diagnosing pneumonia. It shows white patches where inflammation and fluid are filling your air sacs. Sometimes they'll also do a CT scan for a more detailed look. Blood tests help determine if the infection is bacterial or viral and how severe it is. They might take a sample of your mucus to identify exactly what bug is causing the problem. This helps them choose the right treatment. Treatment for pneumonia. The treatment depends on what's causing your pneumonia and how severe it is. Number 1. Antibiotics. For bacterial pneumonia, antibiotics are the primary treatment. It's essential to take the full course of medication as prescribed, even if symptoms improve, to ensure the infection is completely eradicated. Stopping early can make the bacteria resistant to antibiotics. You should also take them exactly as prescribed. Some need to be taken with food, others on an empty stomach. Number 2. Antiviral medications. For viral pneumonia, antiviral drugs may be prescribed if the virus, such as influenza, responds to medication. However, many cases resolve on their own with supportive care. Number 3. Antifungal medications. Fungal pneumonia requires antifungal treatments, which can be more complex and may involve a longer course of medication. Number 4. Fever and pain management. Over-the-counter medications like acetaminophen or ibuprofen can help reduce fever and relieve chest pain or discomfort. Number 5. Oxygen therapy. In severe cases where oxygen levels are low, supplemental oxygen may be provided through a mask or nasal cannula. Hospitalized patients may receive this as part of their care. Home remedies for pneumonia. If you're managing pneumonia at home, there are several steps you can take to speed up your recovery. Number 1. Rest and hydration. Drink more fluids than you think you need. Water helps thin out the mucus in your lungs, making it easier to cough up. Warm drinks like herbal tea can be especially soothing. Your body also needs energy to fight the infection. Don't try to push through it or go back to work too soon. Many people try this and end up getting worse. Try to change positions when resting and sit up periodically to prevent fluid from pooling in your lungs. Lying flat for long periods can worsen congestion. Number 2. Use a humidifier in your room. The moist air helps loosen mucus and makes breathing easier. Clean it daily to prevent mold growth. Number 3. Do deep breathing exercises when you can. Take a slow, deep breath through your nose. Hold it for a few seconds, then slowly breathe out through pursed lips. This helps prevent the air sacs in your lungs from collapsing. If your doctor gives you an incentive spirometer, a device to help you breathe deeply, use it as directed. It looks like a simple plastic tube with a ball inside, but it's great for preventing complications. Now, we want to hear from you. Have you or a loved one ever experienced pneumonia? What helped the most during recovery? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.